Hello everyone, this is Pharmacist Michael, and today I'm going to talk about a drug known as Gabapentin that I get more questions about than any other drug. And the first thing I want to tell you is Gabapentin used to be a seizure drug, and we still do use it for seizures sometimes. And the way it works, it inhibits a subunit of voltage-dependent calcium channels. Now, that really doesn't matter that much for this video, but what I really want to do is I want to explain to you what it can do to you. You know, it definitely obviously has some positive effects. You know, it can work well for sometimes of nerve pain, fibromyalgia. Sometimes we even use it for alcoholics to help them stay off of alcohol. It decreases cravings, diabetic neuropathy, things like that. But gabapentin can also be dangerous. And let me tell you the reasons for this. We know that gabapentin can actually boost the high that patients get if they add it to their opiates, muscle relaxers, or anxiety drugs such as benzodiazepines. And the problem is, combining these drugs together can actually be life-threatening. In 2019, the FDA actually issued an alert because of breathing problems that were reported after gabapentin was mixed with drugs such as opiates and other CNS depressants. So if you are taking these drugs, or if you're a caregiver of someone who is taking these drugs, and I'm talking about predominantly gabapentin and pregabalin. Pregabalin is also known as Lyrica. Gabapentin is also known as Neurontin. If you are taking care of these people, or you're taking it yourself, this is what you should be looking for: confusion or disorientation, unusual dizziness or lightheadedness, extreme sleepiness, or if they're lethargic, they don't want to move around, slowed or shallow breathing is a big one. If they become unresponsive, that is definitely a warning sign, as you can well imagine. If you see bluish color of their skin, of their nail beds, their lips, this shows you that they're not getting enough oxygen and they really should be seen. I'm also going to tell you to always let your doctor or pharmacist know when you start other medications, even over-the-counter drugs, because some antihistamines can make you tired too. And if you add those to gabapentin, you may have a problem. Not only that, but some medications contain a lot of alcohol, which again is a CNS depressant. Now let me tell you some other side effects that can be caused by gabapentin. It does have some cardiovascular effects. The biggest one I can think of is peripheral edema. So this would be where fluid accumulates in your legs. It can cause weight gain, definitely nausea and vomiting. Most drugs can cause that in some people. And there's also some serious rashes that can be caused by gabapentin. One that's called Stevens-Johnson syndrome. 28% of adults that take gabapentin will at least initially become dizzy, which increases fall risk. It makes 21% of adults tired or somnolent. So really what I want to let you guys know is if you need gabapentin for pain or seizures, I'm not telling you not to take it. What I'm telling you is be aware of the side effects, especially CNS depression and respiratory depression, and look for signs of these things happening. We went over the signs. If you're a caregiver, always make sure your patient's breathing, they've got good color. You know, if you have any questions about this drug or any other drug, feel free to email me at michael.brown@sunshinentc.com. I would be happy to answer any of your questions. I just thought I'd go over gabapentin because so many people have asked me about it over the last few months that I really wanted to do a video about it. If you enjoyed this video, please give it a thumbs up. If you know someone who's taking gabapentin who you think might have questions about it, please forward this video to them. Subscribe to my channel, and please be happy and be healthy.